Warning: this podcast may contain graphic and triggering content. Please listen at your own risk. Each individual struggle is different, and everyone's recovery and healing journey is different. Please reach out to a certified medical professional if you need help. Welcome to episode 5 of Stomp the Stigma, the podcast aimed to fight the stigma surrounding mental health through education, awareness, experiences, stories, resources, and the vulnerable truth. Joining me to stomp the stigma today is Mary Wilson. If you were listening last week, her daughter Krista was on the podcast to talk about her story and her struggles. And this week we have Mary to share her perspective on being a caregiver and helping loved ones through their battles.
Hey.
Hi.
How are you?
I'm good. How are you?
I haven't seen you in a long time.
Yeah, it's been years. I was trying to remember like how long it's been, and I don't even know.
No, because we moved in 2000, and I think we saw you for 2 years after that, but
yeah,
it just gets hard when you guys are in activities and stuff.
Wow, so, you moved that long ago?
Yeah.
Oh my gosh.
Yeah, it's been 20 years. Yeah, so you would have been like 8.
Wow.
And so what's this that you're doing the podcast with?
Okay, so I guess when Krista originally shared her story, I don't know when that would be, like 4 years ago or so.
Yeah.
I completely related to it, and I had never seen anybody that I knew talk about struggling with anything like that. And I've been struggling with depression since I was about 9, I think, and nobody really knew about it. Like, nobody really talked about it. And then when I saw her video, I was like, oh my God, there's somebody else. And so then recently, just thinking about how people are dealing with COVID and how it's affecting people's mental health, I really wanted to start a podcast about it. Because growing up, I didn't really have any resources or anybody to turn to.
No.
I had no idea what was happening to me either. So I think it'll be a place to just share other people's stories, and hopefully people can find kind of other things to relate to or coping mechanisms. And I want to share also local resources as well. So I interviewed Krista last week, and she was awesome. She was great. She was amazing.
Really? Good.
Yeah, it went really well. I was super happy with it. So, and she was the one that actually said that I should bring you on because you could fill in some blanks and stuff like that. So thank you for coming on. I really appreciate it.
Well, hopefully I can be of some help, I guess. How are your parents with it?
I actually didn't share it with them for years and years, and then I kind of, I don't know if you would call it, came out to them maybe 2 years ago. Mm-hmm. And I don't know, I didn't really get kind of the reaction or the support that I was looking for, that I had hoped for. So it's like they know about it and they know what's happening, but it's not really something that we talk about at all. So I turned to other people and my friends and instead, but they know about it, and that's also part of the reason why I want to start this, so that people have like another place to turn to. And yeah.
Have you started it yet? Like, has it been public yet?
So I launched it yesterday. I put out a short little 10-minute kind of intro episode, just explaining what it is and what to expect from it and all that stuff. And then so I'm putting out an episode every Thursday. Mm-hmm. The next 2 episodes are sharing my own story. And then Krista's will be after that, and then I will put yours after hers. So it'll be a few weeks away, but yes, it is public. It is on Spotify, Google, Apple, and I'm putting it on YouTube as well.
Wow. So you can see how many people listen to it? And
I can, yeah. I haven't looked at it yet today, but
that's good.
Yeah.
Well, that's the thing, like people can search if they're looking, like searching for something,
mm-hmm.
Then it would be a resource.
Yeah.
Well, that's good. Well, good for you.
Oh, thank you. I'm hoping to bring on some. Yeah, I agree. I'm hoping to bring on some local resources as well, so people know where they can go and stuff like that. So
that's good.
Yeah.
Way to go.
Oh, thank you. I'm pretty excited about it. So.
Yeah.
So I guess I know it's gonna get kind of personal and emotional, and so if there's anything that you don't want to talk about or anything that you're uncomfortable with, just please let me know. And
okay.
Yeah. So Krista last week, she talked about how her first suicide attempt was at the age of 10, which was so shocking to me, so young. Do you remember any of her struggle before that, or did you know about it before that, or was that kind of how you found out?
Actually, I didn't even know then. I don't think. I always knew she was high strung.
Mm-hmm.
Like she would get really wound up about things because anxiety is one of, like, not only did she have depression, but maybe her anxiety was really high. And we did it in high school. One of the counselors got her to go talk to somebody at mental health.
Mm-hmm.
And I remember them saying, "Oh, she was high functioning." Like she kind of showed signs of things, but she was high functioning, and just part of it's there's so many other things. Like as a teenager, there's so many. Just being a teenager, right? Like,
yeah.
You're moody, and and I always thought she would. I didn't understand what it was. Mm-hmm. I didn't realize how serious it was.
Yeah.
I just thought she was just, high strung. And, we kind of, I try and help her work on, not to get so upset about certain things, like just little things would set her off and almost an extreme reaction. So it was, it really wasn't until she went to university that I really found out how serious it was and what it was. Mm-hmm. Like I wouldn't have thought that she had depression.
Yeah.
This is not what I had thought depression would look like.
Right.
So this would have been 7 or 8 years ago. So yeah, it was I know when she played hockey, and when she was in midget, so in high school, we got her. Another family told us about a mental toughness coach. So she would have been in grade 11, I think, when she started seeing her. And she helped quite a bit, actually. I wish we had discovered her when Krista was younger. Because for the anxiety piece of it, it's just, she taught her coping skills and what to focus on, and, just things you can do to make so you don't get so wound up, And the one thing that's sort of been a constant, especially, through that whole thing, was trying for her to understand, control the things you can the things you can control.
Yeah.
Focus on those. The things you can't control, which is what she would get all worked up about. You can't, you can't control those. So don't try and don't fuss about it. Mm-hmm. Or don't, or try to, I know it's easier said than done. But anyway, the mental toughness as an athlete, mental toughness coach was, if you have anxiety, I think that was a resource that I wish we had discovered earlier. So it wasn't when she was in university, like that was the first time she was away,
Mhm.
totally away. Because you think when she's living at home, it was controlled. I made sure she ate dinner, that she got her sleep. When you're living at home, it can be more controlled. But when you're living on your own, away, so she was in Vancouver, it was, yeah, it kind of went off the rails.
Mhm.
So, yeah, she ended up, I don't know, yeah, I remember flying out there and, you're trying to absorb it all and sort of take care of her and support her and
Yeah.
figure out the whole school piece. And she was playing hockey and, you know, it was, I remember thinking like your head's just sort of trying to keep everything straight. So it wasn't until she was 18 that I really knew kind of the extent of it.
Wow.
I feel bad because it had been going on for so long before that, and she was just dealing with it herself.
Yeah. That's one thing I've found with depression is you don't want anybody else to know that you're suffering or you're struggling. And so just trying to keep, I guess, that side of yourself a secret from everybody is a huge part of life. And you, I don't know if it was the same for her, but you end up almost habitually, like automatically lying just to
Mm,
hide everything so that
yeah,
nobody really knows.
yeah.
Yeah,
Well, and part of it, you want to seem, normal.
absolutely. Yeah,
Everyone, like to the outside world, you want to, I think you don't want people to worry about you,
yeah,
and you probably don't even know what's going on fully.
exactly. Exactly.
Yeah.
It took me years to figure out kind of what was happening with me, and I hid it from my family as well.
Mm,
Yeah.
yeah. And there wasn't, you think then too, like the Bell Talks has been like when Clara Hughes, that seemed to me kind of when it really sort of took off, where people did talk about it more,
Yeah.
and then there was just more awareness all around.
Yeah.
That you think that's only been probably about 7 years, 6 years.
Yeah. Yeah.
So you think when you were going through that, there weren't
Mm-mm.
the public awareness kind of. Not saying that everyone's accepting of it now, but I think people are more. There's been more education about it.
Yes. So much more now. So much more. Yeah. Awareness, education, even resources. And I know part of the hard part about when we were going through it when we were younger is that even for our parents, there was no resources for you guys either.
No, no, and it's yeah, it really was a learning curve for us for sure,
Hmm.
like the whole family.
Yeah. So
But
how did you?
like,
Sorry.
no, it was just you kind of you just, I guess that's part of it. You just do at the time. You just do what you think is right, and you ask questions, and you know you don't. It's not. It certainly isn't a straight path. And even now, I think oh, like trying to find a psychiatrist. Oh, like it's not a. To me, it's a broken system.
Absolutely. Yeah.
I remember talking about this with my friend of mine, and she had breast cancer, and she said, when you go for when she was diagnosed, so you go to the doctor, and so when you go in and they tell you, she said they have a whole plan in place for you.
Hmm.
You're gonna this thing, this is a treatment you're gonna get, this is a doc, this is a specialist you're gonna see. Like they have a whole your whole treatment, like the next 6 months is mapped out for you
Wow.
on what's gonna happen.
Yeah.
But for mental health, you know,
Yeah.
you don't. you go to, most family doctors aren't, that's not their area of expertise.
Exactly.
And then they don't always know where to send you. And we kept finding like you'd get a name of a psychiatrist and they weren't taking any new patients.
Hmm.
Or the one thing I always felt was always kind of ironic was, if you went through mental health, you get an appointment. Well, it's 6 months from now.
Yeah.
You're going, well, if you need an appointment, your struggle isn't like, you need help now, not waiting 6 months for an appointment. Like,
Absolutely. Yep. Absolutely.
so finding that like the help you need is, and there's some things like, when she went to the hospital, it gets you stable and it gets you sort of back on track. But then you leave and you're kind of on your own again.
Hmm. Yeah,
Because
she
you don't
did.
go back there for your follow-ups, and they're all inpatient
Hmm.
care. So I mean, it does serve a purpose, and some people stay there longer. But
She
to
did.
me, I didn't feel it was supported as well as it should. Like, yeah, you really had to find the resources yourself.
Yeah.
I, there's places you can call, and there's they say phone mental health and all that stuff. So you do that, but it's the same thing. It's 6 months, or you can't get in, they're full, or it's
Hmm.
not. I don't know. I found it frustrating.
Yeah, Krista brought that up as well. She said once you were discharged from the hospital, they didn't really give you any resources or anything to help you afterwards. You were just kind of on your own, and that was
Yeah,
it.
yeah. She did see. I remember it was at Peter Lougheed. She saw a really good doctor there, and but it was funny because we would go up every day to see her, and she wasn't in there very long. It was a short-term care, and it just like she knew she needed. It was her actually that initiated. She knew she needed help, that she was going spiraling,
Yeah.
and so she needed help, and so she went there. And anyway, the doctor there was excellent, but then he couldn't refer her to another doctor, which I didn't quite understand why. And the other thing that bothered me was we weren't there when she was discharged.
Oh.
We weren't told, and I think it's because she was over 18.
Hmm.
And I don't. Maybe she said she didn't want she didn't want to stay there longer, so she didn't want to wait for us or something like that. I'm not sure.
Yeah.
But you go, when you're leaving, a mental health facility, you'd think if you knew there was support in their family that they should be contacted.
Yeah. Yeah, I would think so.
Because then, like, I could have asked some of the questions that I had too.
Yeah.
But because we really did, like, we were trying to get her the support she needed.
Hmm.
And we have, like, the one place that I don't know if everyone, like, I know for my work, we have a benefits plan, and they have like a wellness. I don't know what they call it, like a number you can call that can connect you
Hmm.
with someone who, like, I work at a school division, so they work with the school division, and so that's how I found a psychologist, and we've been seeing her for, well, since Krista was out in Vancouver, because I contacted her first because I didn't know how to deal with, like, I didn't know how to deal with Krista at the time.
Hmm.
I needed some help,
Yeah.
and so, but I found it through my work, and I don't know if people really understand that that's available, because that was a good resource. And psychologists, yeah, because there was I think a few people that worked for the division. I assume that's with big companies too, like they contract with them, I guess. But that was really helpful. But yeah, we've tried, you know, that's the thing. It's trying different things. Like, and that's you can be referred to like a psychologist or something, but you might not always click with them.
Yeah.
So it's finding one that you connect with. Like, I don't know how you found, like, did you find it easy?
No, I went to my family doctor because I didn't know where to go, and I asked him if he could refer me somewhere, refer me to a psychologist or a psychiatrist or something. And his response to me was that because I was an adult at the time, that it was too hard. It was too hard to get into anyone. So he didn't really want to help me at all. He didn't want to give me any resources. And I remember just sitting there
Excellent.
yeah, you're not even going to help me. I'm telling you that
Yeah.
I'm I came to you because I need help like now, and nothing.
Yeah.
Yeah.
I know our family doctor, she really tried.
Yeah.
But she was running into the same roadblocks we had.
Yeah.
Finding, when I guess we were fortunate we found a psychologist that we were happy with. We had that. And we did it like in that actually, and through work though it was a private, so it went through a benefits plan where not everybody has that option.
Right.
But so then to see psychologists would be through mental health, which I know is the same thing. It's just a long wait period.
Yeah.
Sometimes.
Yeah.
And like it's not saying that they're not good or anything, but it's just such a long. I found anyway, it's such a long wait time.
Yeah.
So yeah, we were fortunate. We had benefit plans through work, so we were able to do that route.
Mm-hmm.
Yeah, that's the one thing I guess I always thought, talking with some of my friends, and you find going through this as a mom, you always think, like, even for yourself, you have to find out who you feel comfortable sharing with.
Yes. Yeah.
But I always thought, as a parent, like, you need support too. You're trying to do the best for your child, but then it is hard.
Mm-hmm.
So I think if I was talking, like, I would encourage parents to make sure that they get the help they need as well, the support they need.
Yeah.
Like, what, be seeing a psychologist, or making sure you're connecting with friends who are supportive, or family. Because my family was very, like, my immediate family, like my sister and my mom and dad and stuff, they never judged.
Mm-hmm.
Because that was one thing you always hear people saying, you're enabling them, or you're letting them get away with too much, or,
Yeah.
and I was fortunate, my family didn't do that. So, but not everybody has that.
Mm-hmm. And
But
that's
I think
all.
you
Yeah.
sort of put away the people who don't understand, or tell you to get over it. Like,
Yeah.
just smarten up.
Yeah.
Deal with it.
Mm-hmm.
You're in your 20s. You should be able to deal with this.
Exactly.
Like, that's people who don't understand.
That's a huge part of the stigma, I think, is people that don't understand what you're going through, and that it doesn't just go away. Like, in my mind, there's not a definitive cure. Like, it'll always be there, but you just learn how to handle it and how to deal with it. And that's a huge part of the stigma, I think.
Yeah, for sure. Yeah, I can remember talking to my mom, and I remember saying, because there's times that when they're at their worst,
Yeah.
like, just because remember, sometimes you think you're trying to deal rationally with irrational. Like when Krista was at her worst, like, I think a lot of times she didn't remember what she had done,
Yeah.
how she acted, because she almost blacked out.
Yeah,
Like,
she
when
did
you get
say that.
worked out. I mean, and that was more when she was like in that 18, 19, 20. It was the worst. But I can remember my mom saying, because I was like, upset and everything, and you don't know what you're doing. And she said, like, think about how you're feeling right now. Like, you're feeling just exhausted and beaten, and, you know, and she goes, imagine how Krista's feeling. Like, if you're feeling this bad and you're not even the one going through it,
Yeah.
so imagine how the one who's actually struggling and dealing with it, how they're feeling.
Mm-hmm.
Oh, that's a good point. So you can kind of, you think, okay, I can. if they're doing their part, then I need to do mine. Just have to suck it up. But I'd say getting support is as the, I don't know, you call it the caregiver. I think that's really important,
Mm-hmm.
that you make sure you have the support, and that you get, like, talking to the psychologist. It gives you tools on how to best handle situations and things.
Yeah.
Even how to words to use, and how to frame questions and things. Stuff like that.
Yeah, that's super important.
I did find age helped a lot.
Mm-hmm.
I don't know if you found that yourself, but I remember when she first was diagnosed, they said, like, the brain develops till it's 26, 27. It doesn't stop developing.
Yeah.
And I'd say that's true. Like,
Yeah, I agree.
it, yeah, like, you can just, the sort of maturity, and just the being able to, things that used to just send her, like, off the edge, was just, you know, you can deal with better. Like, you can sort of process it. And a lot of it's just a combination of things with therapy and medications, and, everything. But age definitely, I think, really helps.
I absolutely agree with that. I didn't know that the brain, or you're kind of developing until 26, 27, but that makes complete sense to me. I'm 28 now, and even in the last couple years, the progress that I've made and the changes, it has been amazing. And before that, I don't think I fully understood everything that was happening to me or everything that I was going through. And when you're a kid and you go from not being diagnosed and people just telling you it's all these other things, and then finally figuring out what it is and how to deal with that, and like really what is happening to you,
Yeah.
that takes such a huge toll on you. And then once you're at like 26, 27, that makes complete sense to me now that I understand it so much more.
Yeah. Because I always thought, really, that old? Like, that's, you always thought it'd be younger.
Yeah, yeah,
But I like, I could just see it in Krista.
yeah.
Just the coping skills, the kind of slowing down. The other thing I found interesting was, well, medication is always, we found that challenging, trying to find medication that works,
Yeah,
because there isn't a, it's not like you can look at an x-ray and say, this is what you need. you
yeah,
know so that whole process was very interesting. But I always found, like, because there's people that say it's just it just masks whatever the problem is. And I remember thinking, no, it's your brain's not producing what it needs to, and so this just helps it.
yeah.
you know your body's not producing what it, and so I think medication definitely, I thought, helped, but it did take quite a while to find sort of what worked.
Hmm.
That's kind of an adventure in itself, but it's yeah. And I think medication too, that's the one thing with all the sort of public awareness and stuff. I think that's become a little more acceptable. People don't freak out as much when they hear you're on medication for mental health issues.
Yeah, yeah, I agree.
It's a process.
So is there any advice that you would give to people in the process to finding the right therapist or treatment or medication?
Well, I think I'm not an expert by any stretch. I think it's to do your research
Hmm.
with the internet and Google and just even like sometimes you have to phone quite a few different places or email or contact and talking to people and you know because that's like even me finding the one through work, like it wasn't really common, like it wasn't something that was talked about at work very much,
Yeah.
so I came upon it. But it's the other thing is, don't feel you have to stick with someone just because you went and saw them. Like if you don't think it's a fit, don't stay. Find take I think take the time to find someone that you connect with.
Absolutely. Yeah.
That, but it is like the what it took us kind of, I bet, 4 years to find a psychiatrist and to get in. Like for her, it was not an easy process because the psychiatrists too, because they're the only ones who can prescribe. Like the psychologist can't prescribe medication.
Right.
But psychiatrist, like just because you're a psychiatrist doesn't mean you're good.
Yeah.
And I don't mean like it's and by good sometimes it means a fit too.
Hmm.
Like some you're not like some I don't know if you have to be on the same kind of page as them and what your treatment's going to look like, and you need their guidance. But you know I remember Krista saw one doctor once, and he wanted to get her off her medication completely. And I was thinking, well, I don't know if, like, I'm not, don't disagree with changing it or reducing it or, trying to, but from what I could observe, I didn't think that was a good plan.
Hmm.
Go off it totally because I didn't think her body was producing what it needed to. So I think she does need medication in some form.
Yeah.
But I don't know. I always think like, especially when cause she would, we had some pretty tough days. Like, I always think, especially when they're younger, it's, I remember thinking like, sort of be thankful for the good days. Like when things are not as volatile, I guess,
Hmm.
like appreciate them.
Yeah.
And it's just trying to, I don't know, getting the support and being able to, I was very fortunate. Krista talked a lot to me. I was lucky that she talked to me
Hmm.
because then I knew what was going on and I could try and help as best I could. And if she needed appointments or whatever, like I could help with that. But she talked to me, and I know not everybody is in that situation. But I think it's just doing as a mom. I think you just do what you think is best. If you always have your child's best interest at heart and just try and help them through because it's going to be a learning process for you too.
Yeah, absolutely. For both
So,
of you.
hmm?
For both of you.
Yeah, that's what I mean. Like it's yeah, like not only are like for you and like Krista, like you're navigating this, you're trying to navigate through this. So
Hmm.
that support person, you're trying to help. And Krista, she talked to her sister quite a bit too. So that was she needed a break from me, I guess. She, you know, but that was good. Like having that, like having if you can have a few people that you can rely on.
Yes. Yeah.
So it's yeah, it is, and it is hard on the family. So being able to talk about it, it's important. There's no roadmap for it. I can tell you that.
Oh, exactly. Yeah.
But it is amazing the number of people who share their stories and their challenges and their
Yeah.
like it is, and like I don't know if you felt like that. Like you're not alone. You're not you're not the only person. going through this, like you do have people you can talk to, and you don't need to be ashamed of it, because it isn't. It's just something you have to work through.
Yeah, that's something that I've learned in the past few years. I think before that, there's a little kind of shame and guilt, and I don't know, you don't really see a lot of other people struggling with it, but the fact that people are sharing now and you have a lot more people to lean on, it has helped so much.
Yeah,
Yeah.
yeah. And there's a lot of things you can read, and I guess you have to find what works for you.
Hmm.
And yeah, I can't. And it is true. Like over the last 7 or 8 years, it's definitely come leaps and bounds.
Yeah. Oh, yeah. So, like, when you were talking about the breast cancer treatment, do you
Hmm.
think a set kind of, or a planned, I don't know what you call it, a planned way to attack the problem, do you think that would work for mental health? Or I guess because everybody's situation is so different, do you think that is even a possibility?
Well, it's. I guess it would be, and maybe like I don't like. I've only seen a piece of you know the whole system.
Right.
Like you almost just being in the hospital. I just remember thinking like you almost need like a triage of if you can be you know if you talk. Was it someone was telling me? I don't know where it was, but the patient would be in a room with like the psychiatrist and the psychologist and the nutritionist or whoever, like a team,
Hmm. Yeah.
and they'd do a diagnosis of you, and then say, like even if it was a pool of people that you could, like, this is you're going to be coming here on Tuesdays at 4 o'clock,
Hmm.
meet with this, you know, this person, and because that's the one thing with it didn't seem like the psychologists and the psychiatrists talked, and even
Okay.
in the hospital, like the doctors there didn't want to talk to the psychologist that she had been working with, because I thought, well,
Oh.
they could give some insight into what had happened in the past, or
Hmm.
they didn't want to speak to each other.
Oh, wow.
The psychologist would have, but and I don't know if that the doctors want to just keep like do their diagnosis without outside influence,
Hmm.
maybe. So I don't know. That was just an observation, and I'm not an expert by any stretch of the imagination. Like it's just my experience.
Hmm.
That there just seems to be like having such a long. It shouldn't be that hard to find a doctor, I think.
Yeah.
And there are the mental health sites that you can go to, like Alberta Mental Health and stuff.
Hmm.
They give you a list of, but a lot of them aren't taking patients, and it's I guess, and part of it is just you have to go through the process, and because then you wait 3 months to get an appointment and find out that you don't really connect with this person, so then you
Yeah.
start the process again, and
It takes a long time, especially when you're looking for help now, right?
yeah, yeah, exactly.
Yeah.
It doesn't seem like a smooth system from our experience.
Yeah. I like that idea of kind of sitting down with a psychologist or a psychiatrist and a nutritionist and everybody kind of there all together. I feel like if you had that group all in one room, they could help you kind of create a plan of attack, I guess, for
Hmm.
your future, whether that's for you to tackle on your own, but to kind of get you started would be helpful, I think.
Yeah, and you're telling your story once,
Yeah, exactly.
same story, you know, the same. They're all hearing the same thing,
Hmm.
and they're probably, there's probably private clinics that might offer that service.
Yeah, that's a really good idea. I like that.
So that's something I don't know. Maybe it is available now. I just haven't found it. But yeah, and
Yeah.
especially for someone who's newly diagnosed, if they're young, like it is, it's new. It's new for everybody.
Mhm.
It's challenging. But whoever the support person is, they need to. I guess my piece of advice is to make sure you take care of yourself too,
Mhm.
so you can be the good support to the, in my case, my daughter, but whether
Absolutely.
it be a sibling or a friend or a coworker, whoever
Yeah.
your person is.
Yeah. Krista had said that you were incredible through the whole journey and you never broke, or at least she never saw you break. Um, and that I can't even imagine, I guess, walking in on your child, say, on the verge of an overdose or getting that call in the middle of the night. How did you maintain your composure and how did you deal with that trauma yourself?
Well, I did break, just not in front of her. I don't know. I think you just. I am quite patient,
Yeah.
just by nature. I think I'm a patient person, so I think that's helped. I think you just think like you just deal with it. This is sort of what's in front of you, and you need to deal with it.
Yeah, you kind of have to.
Yeah, and I guess in my mind it's just you're not gonna. I wasn't gonna like leave her because I couldn't take it anymore.
Yeah.
Like you just, I guess as a mom, you just do what you have to do. You're. I mean, it is challenging. Like there were, it is like it is. She was for a while there. Like she was calling me. I'd get phone calls at 2 in the morning, and when she was away at university, like I would be on the phone with her, either like texting or like she was anxious, like she was getting herself worked up about something. I'd be on the phone with her for 4 hours
Hmm.
all the night. And you think you get her calmed down, and then it would just start all over again. And
Wow.
yeah, then you just, I don't know, I guess you just get whatever sleep you can and hope the next day's better. And you try and, yeah, and seek out supports and help. And like, I think I just, in my mind, it's just, you had to do it.
Yeah.
I don't think I don't think I'm any different than any other mom, who's in the same situation. I think you just do what you need to do.
Yeah.
But yeah, it was times like I'd have to pick her up at 2 in the morning because she'd gone out somewhere. And especially at that 18, 19, 20 age, that was hard
Yeah.
because I think she was more irrational. And the other thing she would do was just take off. Something would upset her and she would just drive.
Hmm.
She would just take off in her car. She'd turn her phone off, or turn the GPS on her phone off. So I couldn't see where she was. And I knew she was upset and she's driving, and, you know, and I remember she did that quite a bit. She went for a stretch there where she did that. Whenever she'd get upset, she'd just take off. And I can remember thinking her dad would get in the car and, thinking he had to find her. And and I was like, well, you have no idea where she is. Like, it
Yeah.
was. And then I thought it was kind of that whole thing of deal with what you can control.
Yes,
I
absolutely.
I kind of in mind. I remember I had this sort of aha moment of I can't I can't do anything about this. I have to wait for her to contact me
Yeah.
and just hope she's safe. But I would, you'd almost be sick. You'd be so worried. But I think it's kind of realizing there's some things that are just completely out of your control.
Hmm. I think that's a very good point that you just kind of do what you have to. because obviously you're not going to give up on her, you're not going to leave her. So you just kind of deal with it and I guess
You do
suck it
what you
up.
think is best. It's not you're not always right.
Yeah, yeah.
You'll make mistakes too, and I guess it's a learning process for both of you.
Absolutely, yeah. Yeah.
But it is. I think you don't give up, and you keep trying to find the help, and you keep trying new things, and like you find, and sometimes it takes 4 or 5 different things before you find one that might, that's successful.
Mhm.
Like whether that be the right psychologist or the right, you know, therapy treatment. Like, because there's all sorts of things like like group sessions you can go to, like CBT and DBT and like all these sort of cognitive training, coping, learning how to cope and things like that.
Mhm.
You know, trying different things and seeing what works for you.
Yeah.
And sometimes it's interesting because you think something that you tried when you were 18, maybe you hated, but if you do it again when you're 24, you might have a different perspective on it.
Yes, that's a very good point. Mhm.
Yeah, it's definitely because I knew, like, with our family, we didn't really know anything about this at all. So it was a whole, it's been a learning process for all of us.
Mhm. So obviously over the years you've learned kind of what support Krista needs from you. But as she's kind of changed and she understands more of what she's going through, how has the way that you treat her or support her changed along with it?
Um, well, I had to sort of learn not to worry about her as much.
Hmm.
Like if I texted her and she didn't text me back, I'd get worried.
Yeah.
Or wondered she didn't pick up. If it rang and rang and rang, stuff like that. Like I needed to. It's hard to kind of let go
Yeah.
because you think if you let go, you're gonna miss something.
Hmm.
I think it was more of a learning process for me. Because you're so engulfed in, like, I was always worried. You wanted to make sure she was okay. That she was taking her medication and going to her appointments, and you know that she wasn't, uh, that I wasn't missing any signs or anything that she was not doing well.
Hmm.
And that took that took a while to sort of, as she got older. You know, the thing is, the one thing we also do is we have the odd therapy session together.
Okay.
Sometimes it's her and her sister, and sometimes it's her and me. Like and I'll go by myself, and she'll go by herself, and so it is helpful. Um, I did find that helpful because then you could kind of talk about things that maybe were bothering you or you weren't quite sure, and just having someone neutral there to,
Yeah.
so they're able to look at it more objectively, and because sometimes you're too emotional. So I found out it actually was really helpful.
Hmm.
So doing that together is good.
When I was going to see a psychologist when I was younger, I used to go, I would talk to her for, I think, like 45 minutes, and then she would bring my parents in for the last kind of 15 minutes, and we would
Yeah.
talk about everything that we had discussed. And it was easier to kind of talk to my parents about it that way.
Yes.
Because if I was at home, I don't think I would have shared nearly as much with them. So I think,
I,
yeah, that definitely helps.
that is true. And sometimes you don't even know how to start or even to
Yeah,
verbal what it is you want to say.
exactly.
And they're sort of, sometimes they're like a mediator in a way.
Hmm. Yeah,
and
they know what questions to ask and how to
yeah,
kind of push you.
yeah.
Mhm.
But I think that is very helpful for to be able to do that, especially if it's someone that you trust, you know, who knows you, and like the psychologist or whoever. It's she knows us, so
Yeah.
it's easier, I think, to yeah, because she kind of knows exactly like what questions to ask her. Kind of, she probably knows what the problem is. It's just
Yeah.
getting us to realize what the problem is.
Yeah. Yeah. So I asked this question to Krista. I'm curious, looking back over the whole journey, is there anything that you would have done differently?
Well, if I wish I'd known sort of the gravity of what was going on earlier,
Hmm.
and to have gotten her help earlier, like when she was a teenager.
Yeah.
Because I think that's, you think about how hard that would have been, and you would know, like going through that on alone.
Hmm.
So that would have been one thing I would have done.
Is there any other advice that you would give to other parents going through a similar situation? Or is there any advice that you wish that you had been given at the beginning of all of this?
It's a good question. I think I would have, to parents going through this, it's not easy, but don't give up. Like, just keep searching for
Yeah.
the help you need. And I would say, like I said before, like, make sure you're taking care of yourself. Make sure that you have the supports that you need so
Hmm.
that you deal with your child, you know,
Yeah.
uh, as best you can. Because it is hard. Make sure you have the supports that you need too. Because it's I think you just need to. It's been a long journey, but it definitely has gotten better. I mean, Krista would answer that better, like how she feels now. I can see improvement in just how she is able to cope with things.
Yeah.
And I think it's probably a lot of people who deal with mental health problems. A lot of people probably don't have, like, people that you deal with in your everyday life at work and stuff. Like, they wouldn't have. They would be really surprised probably to find out that you've had the struggles you've had.
Absolutely. Yes. Yeah.
It's not. I think for, especially if you're having a bad day or a bad stretch, it's exhausting to try and be happy all the time.
Hmm.
Put on the happy face and go to work, and you know I guess it's being able to support during times like that too. Because I found when they were younger that there was just such the high peaks and valleys,
Yes.
whereas now it's not quite as, you don't have the extreme highs and lows. That's the one difference,
I
I think.
agree. It's definitely not as volatile
Mhm.
now that we're older. Yeah.
Yeah. And plus, you have all the things that you've done
Yes. Yeah.
to help yourself too.
Hmm. So, do you know if there are any kind of support groups or anything for I guess, the caregivers or people like yourself? Or is that just,
I
um,
don't. I found, like, I'm very fortunate to have some really good friends.
yeah.
Um, but even then, like, you kind of know, you figure out pretty quick who you trust to share some of this stuff with,
Yeah. Yeah.
because not everyone is able to hear it. You know,
Yes. Yeah.
and not saying not my friend, but some people just, they've never had to deal with anything like this, and they'd like to understand, but they just don't. Like, it's hard.
Krista brought that up as well. Certain friendships of hers, people that just couldn't really handle dealing with
Hmm.
the whole situation. So you have different friendships, and maybe one friendship you don't really talk about that part of your life with, but you're still friends with them, just in a
Yeah,
different way, right?
yeah, that's so true.
Yeah.
Yeah, your closest friends are, those are the ones you confide in,
Yeah.
and family. It's important.
Yes.
They're supportive. I'm fortunate that mine is. I guess, just do everything you can as a parent to help your child, like whatever you feel is best. And I guess don't let people tell you like you shouldn't be doing things, or you know, I don't know what, like texting at 2 a.m.
Yeah.
Turn your phone off. Well, no, you know what? You don't need to know I'm doing this. Still gonna do it.
Yeah.
I'm tell you I'm doing it. If someone judges you for doing things like that,
Mhm.
do what you think is right and what you think is helping your child, and what makes you feel. You're gonna sit up worrying because you haven't, turning your phone off. Like,
Yeah. Okay. One last question for you.
okay,
Is there a stigma or an assumption surrounding mental health issues that bothers you the most, or that you hear most often that is not true?
I can't think of one right now. I know the one thing that with this Bell Let's Talk,
Yeah.
it's the which I think is great. Like, I think it's brought so much awareness to mental
Yeah.
health. I think it's fabulous. But the one thing you kind of notice is that people are tweeting and reposting and doing everything that day,
Yes.
but it's the other 360 some days that you need to keep doing it.
Absolutely. Yeah,
That it's not a day event.
I was thinking about that yesterday actually. Everybody on social media is all over about Let's Talk Day on the actual day, but to keep the conversation going year round is what this is for, what this
Yeah,
podcast is trying to do. Yeah, I really hope that people will continue to talk more openly and more often.
yeah, and I think what you're doing is great.
Thank you.
It is. It's a great thing.
Thank you so much. Well, that is all the questions that I had for you. Is there anything
Hey,
else that you wanted to touch on?
I don't think so.
No? Okay.
I probably talked more than I should have, but
No, that was great. I love that. That was awesome. Thank you so much for coming on. I really appreciate it. Thank you so much for tuning in today. Feel free to reach out at any time. Share your story, speak your truth, and together we can stomp the stigma.